Miss Pagina Omakalon says, what is your defense mechanism? My defense mechanisms tend to be intellectualizing, and I think probably one of my favorite defense mechanisms is sublimation. Sublimation is where you take your negative emotions, whatever, you take your shame, your anger, your anxiety, and you kind of like subvert them and shove them into a productive activity, right? So you take your anger and you take it to the gym. You take your anxiety and you study harder. You take your frustration and your shame and you go do better at work, right? And so defense mechanisms are not inherently bad, but the problem for most people is if you use your defense mechanisms exclusively when you're struggling emotionally, then you're never able to sit with and tolerate your feelings. So again, what I'm saying about therapists is a lot of therapists suck at tolerating their own feelings. They intellectualize them away or pretend that because they're therapist, it's okay that I have these feelings. I'm acting in self-acceptance, when in reality, they're just like using their feelings to hurt people and hurt themselves. And so what good therapists should be doing of every degree level is acknowledging their defense mechanisms, like you're asking me, acknowledging their countertransference and their bias and their cultural misgivings and all these things and their values, and trying to be aware of when those things are running the ship and they're not allowing the patient to be themselves. Because sometimes it's more about us and less